I was diagnosed with Ewing sarcoma in my left femur way back in 1983, just under 40 years ago. I had biopsy and surgery to remove the tumour, and that was followed by 3 weeks of radiotherapy, and also I had chemotherapy, which was every 3 weeks for 2 years. And needless to say, the chemotherapy was very aggressive. About 6 months after the initial diagnosis, I also had a pathological fracture of the femur at the original tumour site, the bone literally falling apart. They managed to save my leg, and by having surgery where they inserted 4 long titanium rods up the cavity of the bone. These rods are known as endus nails, and they fixed the bone in place until the formation of the new bone growth. Anyhow, what I want to talk about is how I coped with life, both mentally and physically at the end of the treatment.
My name's Alice, I'm an osteosarcoma survivor. I was diagnosed in 2008, so I am now in remission for 12 years because I had interferon as well as a trial drug up until 2010. But I did finish my IV treatment at the end of 2008. I hope that makes sense. I was given 9 months of chemotherapy, so I had doxorubicin, cisplatin and methotrexate, and I had limb salvage surgery in between to kind of take out the affected bone, which was my femur, and replace it with an internal prosthesis. That was quite a challenging time. I had to learn to walk again, but I count myself very, very lucky that I didn't have to have an amputation.
Hi, my name's Sophie, and I was diagnosed with Ewing sarcoma on the 21st of April 2005 when I was 8 years old. I've now been in remission for 16 years and have never had any sign of reoccurrence following my year-long oncology and orthopaedic treatment. Today I'm going to be talking about the long-term effects that I experience. 16 years is a long time to be in bone cancer remission, and it does come with a few struggles and a few issues that we navigate our way through.
The side effects of chemotherapy that I experience are tinnitus. I have tinnitus constantly, I have hearing loss, and I have cardiomyopathy. My fertility status is as yet unknown. I haven't had any tests to see where I stand with that. The tinnitus I don't really notice so much anymore. I've kind of grown used to it, I guess. The hearing loss can be an issue when I'm in a crowded room. I can't really hear people speaking to me very well. And the cardiomyopathy does make me a bit breathless, and I do get palpitations now and again. But again, they're not things that really hold me back in my day-to-day life.
But what of the physical effects and things I've been suffering from as a result of all the treatment I had? I get very bad circulation in my left leg, which causes my foot to swell. How I get around that is, when that happens, is just lying down and just staying like that for about half an hour with my leg in a raised position. That's something I've had to live with now over the years. I've also found out recently, I've had tinnitus for many years, and I just put that down to the fact that I've been playing drums, a regular thing that drummers get. But talking to other people in the bone cancer community, I found out that tinnitus is a side effect of the chemotherapy, and yes, I suffer with tinnitus. I've also recently been diagnosed following a bone density scan with osteoporosis, which I'm told would possibly be a result of the chemotherapy, and I'm just waiting for a consultation on that to talk about treatment for that. And they also told me I've got 2 fractured vertebrae, which I didn't know about. Sinus pain, again, I'm told another side effect. That tends to be intermittent. In fact, whilst I'm doing this video now, I'm just suffering quite a bad bout of sinusitis. Over-the-counter painkillers can help with that, and that's what I do. One side effect that I suffer from, which I think is quite unique, is massive bouts of sneezing. The very first time this happened was as when I had my first round of chemotherapy in hospital, which was one Sunday afternoon about 4 o'clock time. By 9 o'clock, I think I'd gone back to the bed on the ward and had a massive bout of sneezing. I remember the nurse making sure I was all right, and I says, yeah, I'm fine. Never experienced anything like that before. And he says, well, hopefully that's the only side effect you'll get. A few minutes later, I'm violently ill, and that was the routine throughout the 2 years of chemotherapy. Massive sneezing bout, and then I will be ill. I still occasionally get those massive sneezing bouts today. Fortunately, I'm not ill afterwards, I have to say. I've also still got a numbness and tingling in my finger ends, which is a side effect of vincristine. I believe with some people that does go after time, but with me, it stuck with me for many years.
For my treatment to be, I suppose, so bespoke with my knee replacement and all the extensions to it, and having my growth plates removed from my other leg, there was a lot of emergency treatments, and I suppose the priority was fixing it for now and worrying about the rest later. But now the rest is happening. So yeah, I have quite a few difficult conversations with healthcare professionals, and usually they're really positive, but yeah, they are still something I try to be a bit more practical about rather than emotional. So for example, I saw an orthopedic surgeon for a consultation, and they discovered a leg length discrepancy, which I've had so many operations to avoid, but unfortunately it still happened. And as they were talking me through the options, I was just so upset. And the thought of having a wedge in my shoe to correct the balance might not seem like that big of a deal to some people, but shoes are very important to me and a big part of me like taking control. So sort of like to that, the surgeon reminded me that actually from my diagnosis, if it was 10 years before, I would have been dead. If it was 5 years before, I would have had an amputation, so I'm quite lucky. And orthopedic surgeons are not known for having a good bedside manner, but things like that I find quite difficult to negotiate still, just because I always have such an emotional response. So yes, that is something I'm still working on.
Fertility is a massive thing for me, and even when I was younger, when I was going through my treatment, it was something I constantly thought about. When I was diagnosed, my mother asked my oncologist before I started my treatment whether I could have my eggs harvested, and the oncologist told her that if they held up the treatment any longer, I wouldn't live long enough to be a mother, and that's something that stayed with me. So as yet, it's an unknown thing for me. I don't know whether the chemotherapy has affected my fertility. I don't have any children, but I'm at a point in my life now where I would like to start having children. And it's kind of a situation of you won't know until you try. So that can be quite mentally draining. And for a lot of people, you know, fertility is the big unknown anyway. But I think especially when you've been through something like chemotherapy and you know there is that risk, it can be even more difficult to come to terms with them.
About fertility, because I was having fertility tests, because of one of the chemotherapy drugs I had affects it. And actually now, if you have a diagnosis the same as me at the same age, you will actually have an ovary removed and preserved. But that wasn't part of the that wasn't part of the treatment back in 2005, which was a long time ago, and I hope it's changed very drastically since then. But that wasn't part of the treatment, so that is one of the, I suppose, long-term effects that they test me for. The team that I saw, basically, I had a few appointments and every single person said to me, if you want a baby, have one now. And why would you not have one now if you're quite stable? But I myself know that I am nowhere near ready for that. So I found that quite difficult at the time. And yeah, I went along to a peer support group, and there was a webinar that I watched done by BCRT. And I just had like a few conversations which really helped. It was really reassuring to say this is in my control.
Well, understandably, I still have had for many years get pain in my leg. Tends to vary, but usually it's like a burning pain in my femur. It's uncomfortable most days, but the burning pain sometimes can get quite bad. Only lasts for about 48 hours, but I found normal over-the-counter medicines don't tend to help very much with that. Nerve pain, which has come on in the last 10 years or so, and that's basically just feeling like somebody sticking a pin in my foot. Very uncomfortable. I just have to put up with that. I've not found any way of actually resolving that.
Honestly, it's not too much of a problem for me at all. I use it like mainly like a normal leg. But it can be painful if I overdo it, like if I walk too much, or if it's cold, it starts aching. So yeah, it does give me pain now and again, but it's not something that holds me back.
A big part of my treatment was my knee replacement, because my Ewing sarcoma tumour was in my femur but too close to my knee joint for there to be safe margins without replacing the whole thing. So I had a full distal knee replacement, and then a few months after I had that, I was actually knocked over in the playground at school and also broke the top of my femur. So the bit of bone, I suppose, between my hip and the start of my knee replacement, I cleanly broke that whilst my surgeon was in Greece. So I did have a broken leg for 4 days, but they gave me a lot of great painkillers during that time. So yeah, I had that surgically fixed as well. So I have a bit more metal work further up from that, that was a bit more of an emergency. And having a knee replacement and having over a dozen surgeries on both of my legs now means that I do have chronic pain, and it fluctuates. For example, with the cold weather, my knee might stiffen up, and I do a lot of holistic things to deal with that. One thing I've really struggled with having a knee replacement, of course, there's lots of physio that I never wanted to do. And now that I'm an adult, I do go to the gym and do a lot of closed circuit exercise, so a spin class and cross trainer to not impact my leg, and swimming. I like to go to the sauna and the steam room to keep it nice and warm and relaxed. I do a lot of holistic things like that to really manage my pain and to, I suppose, feel like I'm a bit more in control of it. But one thing from having a lot of pain with my knee replacement was that when I did have my Elazaroff frame surgery, I was prescribed codeine, which very much did take the pain away, but then I became quite heavily addicted to it. And because of my history, I was just prescribed 100 codeine tablets at a time, and I took codeine basically every day for 5 years. So that was sort of from the age of 16 to 21, I was really heavily dependent on it. And then when I was graduating uni, it was really a time where I ran out of excuses, because I was just taking it to get through the next year and get through to the end of my degree, and then I'll sort it out. Which I did, and I actually found a bit of a lack of support with trying to do that. went to a pain management clinic, and I physically had to say that I wanted to stop taking codeine, that I think it had been too long. I really tried to focus on holistic ways to help with my pain. A really big thing for me was sleep. It would always keep me up. Pain would always keep me up every single night. Wouldn't be able to go to sleep because my mind would only think about that, which I think a lot of us have been through. So now I force myself to wake up at 6 a.m, which is not glamorous and is not nice, especially in the winter. But that means that alongside waking up at 6 a.m, I have a 9 to 5 job, luckily, which is quite easy to structure myself around, and then also going to the gym. I'm really tired by the time it comes to bedtime, and I sort of go to bed at the same time roughly and do all those annoying, boring things that everyone says is good for your sleep, like not drinking alcohol too often. So I don't drink alcohol like during the weekdays. I wake up at 6, so go to the gym, I have a bedtime routine, a morning routine, and all of those things have really helped my quality of sleep, and that has really helped with having pain in my knee replacement, because that was the biggest thing it impacted, was my sleep. And then of course when you don't sleep well, the next day isn't good either. So yeah, that is something I'm going to keep practicing